Hello, and welcome to session 6 of naturopathic philosophy. This is week 6. And this week we're going to explore the third of the 6 principles of naturopathy, which is treat the whole person, or tole totem. So we've already been introduced to an aspect of the holistic approach to patient care when we've considered the vis medicatrix naturae. Because when we rely upon the vis in healing, that naturally results in a holistic view of the patient, because it lends itself to allowing the innate intelligence and vitality within the whole human organism to bring the patient back to health. So that's our first real foray into holism as a naturopath. The process of healing and the therapeutic order, which we've already looked at, are also arranged holistically because they counsel a naturopath first to look at all the aspects of the patient and their lifestyle, wherein there are many, or maybe many, disturbing factors that might be impacting health. So in this session, we're going to start exploring how we actually go about addressing a patient in a holistic way, which is a very different way of looking at a patient than, say, used in conventional medicine. And so we'll look at how we investigate all the aspects of a patient and to create a whole picture of how their illness is impacting them. Starting off with a quote, as per usual, "In oneself lies the whole world. And if you know how to look and learn, the door is there and the key is in your hand. Nobody on earth can give you either the key or the door to open except yourself." So this quote serves as both a reminder to look deeply and learn all we can about our patients as a naturopath in order to help them find the key, and also recognizes that we don't hold the key, the patient actually does. So a naturopath approaching a patient needs to acknowledge that the patient is the one that holds the key to their own health, and it is the naturopath that simply helps to facilitate or be a partner in that process, so that the patient can find their own wholeness. So going to the definition of this principle, this third of the 6 principles, this definition goes across this slide and the next. Health and disease result from a complex of physical, mental, emotional, genetic, environmental, social, and other factors. Since total health also includes spiritual health, naturopathic physicians encourage individuals to pursue their personal spiritual development. Naturopathic medicine recognizes the harmonious functioning of all aspects of the individual as being essential to health. The multifactorial nature of health and disease requires a personalized and comprehensive approach to diagnosis and treatment. Naturopathic physicians treat the whole person, taking all of these factors into account. So I'm just going to back up to the prior slide, the beginning of this definition, so we can break it down a little bit. This definition is setting out a biopsychosocial spiritual approach to assessing and treating patients from the naturopathic perspective. So naturopaths are taking into account not just the physical, but also the patient's state of mind, their mental functioning, their emotional state, and emotional intelligence, and exposures that their particular environment presents, the nature of their family and social relationships, and their connection with their own spirituality, whatever that might be. In order to work with patients in this way, a naturopath needs to get to know their patients very well, and within the context of a long-term continuing therapeutic relationship. So a naturopath must develop trust with their patients so that they will share with us their experiences and their challenges on all of these levels. And that's a very intimate thing. It takes sometimes a while to develop that type of trust with a patient, and having a long-term therapeutic relationship with good rapport is one of the things that's really key to having success with naturopathic medicine, in my view. And that helps us get a strong picture of who their patient is as a whole person. In order to do this, a naturopath must provide a really safe and non-judgmental space for each patient to be the whole of who they are without feeling like they're being judged in any way. And that can be a really tricky thing, because once you, for example, once you know that eating McDonald's is really detrimental to your health, then you might actually become a bit judgmental towards people who continue to do that. And so a naturopath always has to keep an eye on their own judgment and ensure that they're providing a really safe space for their patients to come in and really be all of who they are, so that the naturopath can meet them in that place. And so, as I've mentioned before, that can call for a great deal of time and patience on the part of the naturopath and the patient. So it comes down to establishing an understanding of how much time these things can take. So the individualized approach that naturopathy takes is really represented in this definition as well, because a naturopath is going to look at many facets of a person when they are considering what might be causing and what might remedy an illness in a given individual. Each person's experience of illness is different, even if they have the same illness. If I have two people that I'm seeing that both have Crohn's disease, each one of them is going to have a different experience of that disease, and it's up to me to figure out what is the particular experience that this person is having of this disease. And of course, by virtue of it being the same disease from a Western pathological perspective, there will be some similarities, but there will also be some differences. So it's good to look for the patterns of similarity, which we're going to talk about when we talk about constitutional medicine. I think that's next week. And then it's good to look at the individualized aspects when you're looking at the whole. So going on to look at the difference between holism and reductionism. So we hear about holistic health a lot now, and I want to just explore the definition of what is holism. This is just a dictionary definition. The theory that parts of a whole are in intimate interconnection such that they cannot exist independently of the whole, or they cannot be understood without reference to the whole, which is thus regarded as greater than the sum of its parts. So the last part of that definition I'm sure that you've heard before. The whole is greater than the sum of its parts. And this actually forms the basis of systems theory. So when we apply this to the human organism, we can start off with, say we start off with a cell within the human body somewhere, doesn't matter where. The behavior of that cell as a whole cannot be predicted from the behavior of the individual organelles within that cell. So you can't look at a mitochondria and determine how a cell behaves. You can't look at RNA and determine how a cell behaves. You have to look at the whole. And when you go a little bit further, you can see that the behavior of a tissue in the human body can't be extrapolated from the behavior of a single cell. And the reason for this is because, for the most part, tissues are made up of a variety of different kinds of cells. There are exceptions to that, of course, but it is common in the human body for that to be true. And even if it were a system or a tissue that were made of all the same types of cells, for example, like the epidermis of the skin, which is all simple squamous cells, we still can't predict the behavior of the skin as a whole from the behavior of a single squamous epithelial cell. And by the same token, if we start looking at organs, we can't predict the behavior of an organ just by looking at the behavior of a single cell or a single type of tissue. So the organ, again, is another level of complexity, and we have to look at the whole there. So we can go on and on with that all day. That's one end of the spectrum, and if we go through the spectrum, we'll skip all the middle bits and come to the end of that. We can go outside of the human, and we can say we cannot predict, first starting at the limits of a human, we can't predict the behavior of a whole human by looking at the behavior of its individual anatomical or physiological systems. So my behavior can't be predicted by simply looking at the behavior of my nervous system, for example. Going beyond that, the behavior of a family or a community cannot be predicted from the behavior of a single person within that community or family. I'm sure you've all experienced that. And the behavior of an ecosystem, if we look at the world as a whole, or even isolated, to the extent that ecosystems can be isolated, an isolated ecosystem like, say, the Amazon rainforest, for example, that the behavior of that ecosystem cannot be predicted from the behavior of one plant or one animal or any other one component within that. So we see that systems are very complex, and if we're going to look at figuring out how something behaves or why it's misbehaving in the instance of a person with an illness, not the person misbehaving, but the body not behaving according to what we would expect as normal, we have to look at the whole in order to predict that. So the whole is always greater, it's always more complex than a simple sum of its parts, and that's what this definition points out. And clearly, most of the systems that a naturopath is going to be considering, whether they are looking within the human organism or if they're looking at the entire experience of a human to include their family and community or their socioeconomic status and things like that, their culture, that's obviously very, very complex. And so in looking at a person holistically, we have to acknowledge that there's a great deal that we don't even know yet about the way that a human organism works. And I think that this is really, really important when you come down to discussing, for example, the topic of evidence-based medicine or evidence-informed practice, for us to acknowledge that we have a lot of evidence and a lot of science that tells us how certain things happen within the human body. And then we have a lot that we don't know about the way that the human body behaves as a whole or even in its parts. So we know a lot of different biochemical pathways. There are probably lots more that we don't know yet. And when I think of this in my mind, I think of what we know about how the human body works right now is like this, and what we don't know is like this. So, and when I'm talking about the human body, I'm talking about the way the emotions work, the way the different parts of the brain work, the way mental patterns work, as well as the way physical things work, which we tend to know a lot more about. We're getting to know more about how the human body works on an energetic level, and energy medicine as well as quantum physics, quantum theory are starting to inform that from two different directions that are actually starting to come together. So that's pretty exciting. So we need to acknowledge when we're looking at a person holistically that not all humans are the same. Obviously, there's a vast amount of variability among individuals that we have to make room for. I love this picture because of the fractal geometry that's in this particular type of broccoli, and we can look and see the spiral patterns that are there within each one of the broccoli florets, and then with the way that the whole head of the broccoli is there. There's obviously some pattern there that we're looking at, and looking at that as a whole, you get a whole different picture than if you're looking at it as one of its parts. So I really like that. When we begin to see in terms of wholes rather than parts, patterns appear that a classical model of simple linear cause and effect cannot capture. And so this is a general statement from systems theory, and which I mentioned on the prior slide. So the idea of holism, when we define it this way, can really seem a bit overwhelming when you think about it first in light of any type of a holistic health practice, because how in the world can any practitioner ever grasp or try to assess or make effective recommendations for treatment that are up to the complexity of the human organism and the complex systems within which it interacts? That's a crazy amount of complexity for anybody to even try and wrap their mind around. There's no way that a naturopath or any other healthcare practitioner is ever going to be able to subsume the entirety of all this complexity within their mind, because there are limits to the human mind, obviously. So there's two bits of good news in response to that concern. First is because of that complexity, we can let ourselves off the hook and say we are never going to grasp the whole in the real sort of truth of that word, such as the human organism. We're just not going to be able to do that. It's beyond our capacity. So we can let ourselves off the hook and not feel like we have to really be able to grasp and explain the whole, because we simply can't do that. But thankfully, we don't have to completely grasp it, because we have the vis medicatrix naturae to rely upon. And we look at that as being a complex enough intelligence, subsuming all of the natural laws by which the human organism lives. We look at the vis as being complex enough of an intelligence to grasp it for us, to grasp all that holism for us. And so whatever extent we can't grasp the whole of who a human is and everything that they interact with, we can rely upon the healing power of nature to take the organism, the human, in the direction of healing, despite the fact that we cannot conceptualize of the whole. So that's the beauty, again, of the healing power of nature. So we simply, as a naturopath, need to identify what needs of the organism are not being met and what factors are pushing the organism off balance, and we can correct those things. And if we look at that from a holistic point of view, then we're looking at physically what needs are or are not being met or are pushing a person off of balance, as well as looking at it on a mental level, on an emotional level, and on a spiritual level. So the second bit of good news with regard to all of that complexity is that we do have holistic systems of medicine that are designed to help us recognize particular patterns that tend to emerge within the complexity of the human organism. So I mentioned that next week that we will be looking at constitutional medicine, and that is medicine that helps us look at pattern identification in a holistic way, so that we can see what patterns are occurring in people, and we can relate those patterns to what this person might need as a whole to help them move towards healing. But for now, we're just going to remind ourselves that though pattern recognition is a very useful framework for taking a view of a patient, we also have to remember that our medicine is individualized, and we have to take care not to make assumptions about a patient's illness or experience based upon seeing patterns that we've seen before. So going back to the example of Crohn's disease again, if I've seen 20 patients with Crohn's disease over the last 5 years, and I've seen certain patterns that crop up that indicate to me through my experience, or if there are things in my learning from my own teachers that tell me that there are patterns that tend to occur in people with Crohn's disease, I don't want to get too reliant on that. And I want to make sure that every time a new person with Crohn's disease comes into my office, that I'm looking at them with fresh eyes and that I'm not attributing too much to that pattern. So we'll juxtapose all of the foregoing about holism to reductionism. And I love this quote, when you have broken the reality into concepts, you never can reconstruct it in its wholeness. And so this is a cautionary alert to naturopaths and other holistic practitioners about the possibility of losing the view of the whole person when we spend too much time analyzing the systems within that person, which is certainly something that's becoming more common in naturopathy at this stage. One of the reasons why the first 2 levels of the naturopathic therapeutic order are able to provide such a strong foundation for returning and maintaining health is because they stay in the whole view of the person. And so this is one of the best places where the naturopath can guard against looking at the person in too much of a reductionist view. So turning to a definition of reductionism as a contrast to holism, reductionism is the practice of analyzing and describing a complex phenomenon in terms of its simple or fundamental constituents, especially when this is said to provide a sufficient explanation. So when we contrast this reductionism, which also can be referred to as materialism, so looking at things on a material level that we discussed earlier this semester, In reductionism, we're looking at the minute parts of a system and extrapolating or attributing behaviors of that system to its isolated parts. So a really good example of this is in conventional medicine, and this is also adopted by the natural medicine field for a long time, although that's starting to change a bit. Decades ago, there was a discovery made that atherosclerotic plaques, the plaque inside of our arteries, was composed primarily of cholesterol. And so the idea took root that if we reduce the dietary intake of cholesterol and we develop drugs that reduce the amount of cholesterol in the bloodstream, then that's going to reduce the amount of plaque that builds up inside the arteries. So this was a really reductionist view of looking at a single molecule inside the bloodstream and changing the availability of that one molecule inside the blood to prevent it from going into the walls of the arteries and creating these plaques. And the belief was that that would be what would reduce heart disease. So that's a reductionist view of heart disease. It's looking at one molecule and the effects that it has, the potential effects that it has on the buildup of the symptom or the signs of the disease, which is the plaque inside the blood vessels. More recent research is actually showing that the one act of reducing the amount of cholesterol in the blood is actually having very little effect on the deaths from heart disease or deaths from other causes that are related. So for example, there are studies that show that in women, the use of cholesterol-lowering drugs will reduce cholesterol in the bloodstream, and they reduce deaths from heart disease, but they don't reduce deaths from all causes. And so I find this very, very interesting, because what it's saying is that the women who take these drugs, they might not necessarily be dying of heart disease, but they're dying at the same rate of other things. So the drugs themselves could be having a negative impact on other parts of the body that are causing those parts of the body to fail sooner and be a different cause of death that wouldn't have been there without the drug. So that's not to say that a reductionist or a materialist view of the minute workings of the human organism is not valuable, because it is. And conventional medical doctors, naturopaths, other types of healthcare practitioners utilize this reductionist information all the time, and we all find it of value. The important thing to keep in mind is that we have to realize where that information fits into the larger scheme of things. A piece of information about the way that one biochemical pathway works, or the way one molecule is behaving in the body, one type of molecule, is not going to give us the truth of how the human organism functions. We need to look at that as part of a larger conversation of the whole picture of the organism, and know that the reductionist information has its limits, and utilize it as such. So just referring back to the standard model of diagnosis and treatment of disease, which we saw earlier this semester, and we'll come back to this now because we've got some different ideas to apply to it now. Diseases exist as discrete entities in the standard model. Disease entities can be identified, can be eliminated through treatment, and the evidence-based applications of drug or surgery constitutes the appropriate and effective treatment. So when we look at the reductionist model, which is the standard model of diagnosis and disease, we can see how reductionism fits in here. We've got a disease identified as some discrete entity within the body that doesn't have reference to the whole. It's something that can be identified, like a molecule that's, there's too much of this or there's not enough of that, and it's that one thing that is tagged on as the disease entity. And obviously, in many instances, there are lots of different things that are involved in identifying a disease entity. It's not often just one molecule. But they are things that can be measured on the molecular level generally. And conventional medicine is fighting the disease. So they're looking at the disease as the entity to be eradicated without a great deal of reference to the person involved, or individualized traits or behaviors that might be involved in why the illness developed in the first place. Contrasting that to the naturopathic model for restoration of health, we again can see the holism in this definition. I'm not going to read the whole thing here. You can go through and read that yourself. But we see the more holistic view reflected here, where it's the individual patient who's being treated instead of the disease that's being fought. And that is a holistic model when we look at the person as a whole and work on healing, helping the person heal as a whole. Likewise, when a naturopath diagnoses, we look at how the entire person is responding adaptively and individually to the various disturbances that might be present in their life, and we take the nature of the whole organism into account when we rely on the healing power of nature to deal with the complexity of the system as a whole and to help bring that person back to health as a whole. So that's the end of the first part of session 6. Thank you for your attention, and I will see you again in the second part.